All right, it is 4:15. Hello, hello, everyone, and thank you all so much for coming and joining us for our Q&A for the family engagement, what we think versus what is. I'm Candace Simon. I'm from AMCHP, and I will be asking our presenters the questions you have submitted in the platform. As I mentioned before, if you did not get a chance to submit your questions on that platform, please feel free to chat that in the chat box now in the Zoom. Feel free to introduce your name and where you're from in the chat as well. And now, without further ado, Kim and Melissa, would you please introduce yourselves?
Thank you, Candace. And hello, everyone. I hope you enjoyed our video. We had a great time putting it together, and we want to be of help and support to you and be able to answer all of your questions today. We are full-time at the Ohio Department of Health as state staff members, serving as parent consultants. Melissa, would you like to say hi?
Yes, of course. Thank you, Kim. My name is Melissa Jackson, and like Kim said, we are the parent consultants. We hope you did enjoy our presentation, and we're excited to answer any questions you have.
I do see some on the platform. I will start with Ms. Marianne, and feel free to go into further detail of the question. Unmute yourself. You're more than welcome to do that. Can you share the process of creating PAC?
Sure, I'll be happy to share that. Prior to coming on board as a state staff member, I served on the Parent Advisory Committee for almost 20 years because I have a child with a special healthcare need, and she was receiving services through the CMH program. How that team was comprised is it is a team that has bylaws within the Ohio Department of Health. Those bylaws were created a very long time ago, and they drive that team. It's a team of 15 parents of children who are receiving services through the CMH program. They represent many diverse backgrounds, diverse medical conditions, different regions within the state of Ohio, and they are first and foremost parents of children with lived experience. And so that team has been active for, I'm going to say, at least 2.5 decades, perhaps more. And it just gets stronger as every year moves forward. Sometimes we have parents who serve for their 3-year term, and then sometimes we have parents who will serve for multiple terms. So it just really depends on where they are with their ability to be involved. And we also allow them, if they have seasons where they need to step out for a tad, for maybe a few months, if their children are struggling more medically, we allow that. We give them that grace intentionally, because we know that while they may miss a meeting, maybe a quarterly meeting, they're still engaged otherwise. And so we meet them where they are in that process. And we do have an application process that parents use to apply to request to become a team member. And so we use that application process to help support them so they can share with us as much as they feel free to share with us. And then it allows our co-chairs of the Parent Advisory Committee the opportunity to view their information, and that way they have that ahead of time once they come to a meeting as a guest.
And I will say, as far as engaging families and new families to build the PAC, we heavily utilize social media. So we did go into a lot of the families with special healthcare needs in Ohio groups, and we asked the admins of those groups if they could share, or if it was a comfortable environment, we actually went ahead and shared those links to those applications. Additionally, Kim and I, when we started, we made sure to create a database of all of the nonprofits in the community that serve children with special healthcare needs. And then we started having meetings with all of those nonprofits and trying to build a rapport with them. And so we often encourage the individuals that run those nonprofits, if there's a family that's just really itching to get more involved, or a family that is really good at sharing their story or anything, honestly, if they just feel inclined to definitely share that application. Um, and then, of course, we are constantly pushing it out in our newsletter. So obviously, PAC members have to have a child on the CMH program with our Children with Medical Handicaps program. So we have that newsletter that goes out, and we're constantly reminding them in that newsletter that they can get further engaged and further involved. So it's just really a variety of ways, but we definitely have found the right people, which is wonderful.
Thank you. And thank you, Marianne, for asking the question. We have a question from Deborah. How does the PAC express themselves to providers as a united voice?
That's an excellent question. Thank you for that. So what we do is we intentionally involve them in many of our projects within our block grant funding, within our state program that their children are receiving services through. We ask them some tough questions, and we want them to give us real answers. So we just within our spring meeting, we asked our families to take a deep dive into our children and youth with special healthcare needs block grant priority, and then the objectives and strategies, and tell us what they felt their reaction to that was, and how they see us best supporting families by following that plan. And then asking them also, what did we forget? Is there anything we did forget? Our topic is around transition, all things transition. And we know that many families are experiencing transition at a deeper level because many of our children's hospitals here in Ohio are now transitioning care to adult centers. And so their providers are changing. There are also, we have many patients, many children who are living longer, stronger lives because of medical advancements, which we are very grateful for. And so they're talking about transitioning from, educational settings to perhaps job, career, different pathways of life as it moving into adulthood, what other services and supports are available to support that transition. And we help the families connect to those programs. But we wanted to make sure that the PAC knew that we wanted their voice to be at the forefront. So just really quickly, we comprised 4 different work groups, and we asked the PAC members to be that 5th work group to represent family engagement. But we also challenged them further to ask them to be on each of the 4 other work groups. So there was a lived experience, family's voice represented with the 4 of those work groups. And they very happily we're glad to do that. They were all virtual meetings. And so there was a question in the chat about how do we support them with their time and their experience. We currently support the PAC members by providing them a reimbursement if they have childcare expenses. And then if they travel to a meeting, we also provide them reimbursement for their mileage if they are traveling to a meeting. And so those are some things that we're doing currently to ask them to be heavily involved.
And I will say, as far as expressing themselves, so Kim and I do sit on the MAC, which is the Medical Advisory Council, and we also sit on the Parent Advisory Committee. So we're able to a lot of times take that information, as well as our Title V director, Patrick Londergan, who sits on both, and he normally is the mouthpiece between the two that connects them. Additionally, a lot of our PAC members are heavily involved in advocacy. And although we as state employees are not allowed to speak directly to legislators or do any of that advocacy on a high level, we are able to support them. And so they actually, as a group, sometimes will text each other or work together on projects. We actually had several of them go and give testimonies, and often the PAC are the first people that whenever we've had the CMH program or the funding for it kind of been challenged or trying to figure out if it's needed, the PAC members came together and provided testimonies and spoke to providers, spoke to everyone involved. And so it's really, I think the big key is getting those PAC members to trust and support and engage one another. So really, we're just kind of the facilitator of bringing the people together and then making them comfortable with each other by offering them opportunities to bond and then be powerful on their own.
Thank you. I see Debbie, your hand is up. This was your question. Did you want to follow up?
Yes, please. Thank you. Thank you, ladies, for answering that. I live in a very rural area where it's majority of the population is African American and Hispanic. We have trouble getting people to engage. I like the idea of the PAC. I would like for more of us to come together as a group. It is still hard for us to get into the providers' offices, the actual doctor's offices, to say, hello, we're here. It's important to hear these families' voices. I'm not sure what we're missing as far as the connection between the families and the providers. How do we get to the point of actually being able to garner their attention so that they know that, instead of having to bring us to the table is built with us already in mind? I think that's very important. Yeah, we're having to start from where we are, but I would like to see eventually the quote unquote mythical table be built for us, as a given. Oh, we're going to be included. We already have a seat there. It's been prepared for us. So how do you guys get that across to the providers that these are important things? This is important to listen to.
That's a really wonderful question, Debbie, and I appreciate you asking. We have several PAC members who serve on the CMH Parent Advisory Committee. They are also serving on hospital-based parent advisory teams within each individual hospital. And so many times they will bring updates to the PAC of things that are happening within that hospital, within that family advisory committee or that council, that they have the opportunity to serve as peers on that board by connecting with different specialists and within that hospital setting. So that is something that you might consider. And then also that just grows that strength of knowledge from that lived experience perspective by having that voice represented within that space. The other thing that you can do is simply share your personal story with your specialist, your child's specialist, your child's physician. And one of the things that Melissa and I have been doing is we have been trained as Charting the Life Course ambassadors here in Ohio. And so we've been helping our PAC learn about how those Charting the Life Course tools can empower their voice, not only for their child, but for their family. And it can help in any setting, whether it be with the hospital team or whether it be with the school team or employment, especially during those transitions topics. It's helpful to have that tool in their hand so their voice, their child's voice, can be displayed in a visual format. So people that may not know what they don't know have the opportunity to better understand. And then always just simply helping parents to have access. We do a lot of sharing of resources and information of different parent trainings that can occur that parents can, engage with. We do a lot of that, and that empowers them to, again, help them learn how their voice can be so powerful, and yet help others learn how they can support families who are experiencing some really difficult challenges of life. Because there's nothing easy about being a parent of a child with a special healthcare need. There's just not.
No.
And so, and helping people understand what life is really like is so very important. And those trainings really do help parents a lot.
Now, is that training something that is solely for Ohio, or is it something that is transferable to Florida, or do we have something like it, or should we?
We share a lot of Ohio-based resources, but we also at times have access to different national trainings for parents.
Mm,
And so we share them everywhere. We have we, like Melissa shared, we're on a lot of different social media pages. And so we always just say, hello parents, here's a training that you may be interested in that may help you. And so we share it that way quite often, as well
okay,
as sharing it with our PAC members.
okay, because, I feel like I'm going through the back door a lot of times. Because we're, to my knowledge, as state employees, not allowed to, do a whole lot of things that we could do on our own personal, private, platform. Um, I want so much to be able to communicate one-on-one with parents, but what I'm finding is that I'm having to send these resources and these options or opportunities for classes to people like at the school board that work with families, or, to the physician's office, hoping they will pass it on. And so it's a little difficult to try to get in that back door to get to the parent, when I feel like my first thing should be I should be able to just talk to these parents, but I'm having a problem getting there. Any thoughts?
So I will say, just as a follow-up to Kim, and then to answer your question too, with the childhood cancer work, we did not have an existing oncology group to pull from at the hospital. And so what we honestly had to do was go to social media. We went to existing childhood cancer groups. And then also we actually met with a lot of the nonprofits that serve childhood cancer families, and we got connected that way. And so they started actually sharing our contact information, mine as the leader of the work group, and trying to let people know about us and that we were wanting to gather their lived experience and then possibly have them even join us on work groups. And then I personally, I got on Google and I looked up all the different oncologists for the different children's hospitals. And I kid you not, started trying to find emails. I actually called a few hospitals and asked for some of the oncologists' emails. And I literally reached out to them and said, look, this is what we're wanting to do. We're wanting to bring together families and oncologists. I just honestly, not everybody answered me. In the beginning, it was kind of crickets, but slowly a few people did. And then as I met with them and spoke with them, they started giving me more contacts. And we very quickly built a huge network of oncologists and providers that wanted to hear from the community, that wanted to be involved. And then actually now what we're doing when we set up the summit and then these webinars is we're having both come to the table. So we're having families come to the table and providers, but we're making everything geared to families. And we're letting the providers know this is geared to families. We're not talking huge data. We're not talking over their heads. We're not using acronyms. But honestly, the feedback we got from the providers and the support staff and the social workers that have come is they actually found that really refreshing because they're people too, and they want to be talked to like a person as well. They don't always want to hear all the clinical stuff. And so the fact that we had them all in the same room and they were networking and they were together hearing, lived experience stories was really powerful. And they actually, all of the providers gave us such wonderful feedback and said they couldn't wait for this year because many of them told us it regrounded them. It reminded them of why they got into the field in the first place. And so really, I think just trying to stand up those small events, even if you don't want to do a big summit, just standing up those small events, like a little 1-hour webinar or even just a roundtable, is the best way to do it. But it does take grunt work. Unfortunately, I got a lot of bounce back emails. I was making up emails at times just to see if I could get somebody. So I wish I had a better answer for you, but it is a little bit time consuming, but definitely very worth it.
Well, I appreciate your answers and your time taking for me to answer my questions. I appreciate it very much. Thank you.
Of course.
Thank you, Deborah, for your question. We have about 5 more minutes. This went so fast and such a great enriching conversation. We do have a couple more questions. Hopefully we can get them in before time's up. We have, I have Whitney. I have noticed that the ways we engaged families pre-COVID don't seem to be as effective now, such as getting less responses, and they're having a hard time identifying the breakdown. Any guidance from your experience?
Sure. I'm sorry. Did you want to speak, Melissa?
I can go ahead and jump in.
Sure.
So I will say that I think one of the biggest things is the distrust that all of a sudden nobody really knew what health departments did, and they didn't mind. And when you told someone you worked for the health department, they're like, all right, that's cool. And now you tell them that you work for the health department and they're like, oh. And so I think in general, healthcare providers, teachers, all of us really took a hard hit in the last few years, and there's distrust now that there never used to be. People really used to trust the health department and nurses and teachers, and now sometimes they're weary and it's hard. And so I try to look at it as a parent perspective, but I think the biggest thing we learned, and even our communications department told us, with the summit and some of these parent groups and things we were wanting to get out, they were like, you know what, let's not post that on our main social media page from ODH. Why don't you post that under, the maternal child health program? Or why don't you ask nonprofits to share that? Or why don't you guys just go ahead and post that up around your primary care docs? And honestly, that was the workaround that we had to do. And it's a sad truth is there was so much negativity that we were getting on a lot of our health department feeds that we started creating smaller channels to reach out to families. We started using our newsletters and things that we know might be received well, because they're not necessarily considered COVID, Department of Health, you know what I mean? They're just serving families. As far as social media, I think there are a lot of people that social media blew up even bigger, if that's even possible, during COVID. And there was so much misinformation. There's so much that families are getting hit with nonstop. And so we really had to kind of think about, okay, strategically, where are we placing things? How are we reaching out? And then how much are we asking them to do? I can honestly say I've become a bit of a hermit since COVID happened. I have a child that is immune compromised. I'm currently immune compromised. And so it was one of those things where I got so used to not going out and being around people that it's kind of actually hard to be around people now. So acknowledging that and still offering those online spaces, still offering them short times to interact with us, and try not to come off too pushy, and being very clear about what they're going to do, how much time it's going to take, what they're going to get for doing it, and how it's going to help. And that is, I think, the biggest thing right now.
The other thing that we did was, pre-COVID, our parent advisory committee, we met quarterly with them in person. And so they would drive, maybe up to 2.5 hours one way to get to Central Ohio from the 4 points of the state, 4 farthest points or less. And so they were spending quite a bit of time in the car. And so we switched to a completely virtual platform to keep their meetings going, because that was important to them and to us. And so it allowed them to engage even further and deeper because that travel time wasn't present any longer. And so they appreciated that. And so one of the really cool things that we've learned through COVID is those meetings can now still remain to be virtual. If we do go back to in person, we can offer both. And so that's a bonus.
Thank you so much for your question, Whitney. And I thank you all for attending. Thank you to our speakers. It was very enriching, engaging, enlightening, and I think you provided so much information and tools. I'm wondering if there's a way for them to, if the questions that didn't get answered, if they can email or somehow connect with you both for their answers, because we're at our time. And I don't want to take up any more of your time if you need a break in between sessions. So I just wanted to thank our speakers, Kim and Melissa. I want to thank our attendees for coming and participating in the Q&A. The questions were very, very thoughtful, and I hope that you were able to get some tools from this. And please check the chat box. It looks like, Kim, you posted some links. Please, if you have not done that already, please take note of the links. Without further ado, I again thank you so much for coming to our session, and we hope you enjoy the rest of the conference.
Thank you, everyone.
Thank you.